identifying patient's problem is a significant step in our assessment and management of patients. Now, conventionally, this step is done, or this step is practiced by identifying the chief complaint. Now, the idea behind chief complaint is that it helps us to get the patient's problem, understand patient's problem from their perspective. So physiotherapists are encouraged to write it as the patient says, to record it from the patient's own words, which is assumed that if it will give us a patient's perspective of the problem. But this practice of chief complaint has fundamental issues in it, in a sense that it doesn't really help clinicians in terms of understanding problem well, which consequently leading to solving the problem. It affects our ability to solve the problem. I'll tell you why. Let us say we are asking the patient, what is your problem? And the patient may have a list of problems. Now this list of problem may include, say in a patient with stroke, if you ask them, can you list what all the problems you have, and most patients would use generic terms such as my hands are not working, my legs are not working. Or some patient may say it little bit specific, saying I'm not able to hold objects in my hand, and I'm not able to stand or walk. Now if you the conventional practice of writing chief complaint involves writing all these things, right? My hands are not working, my legs are not working, I'm not able to grasp things, gripping problem. If you list it out, now what is the value of writing like this, right? Say for example, if you have written that difficulty in gripping, right? Now how this information is going to guide us in terms of understanding the patient's problem, the nature of problem, or developing assessment plan or treatment plan? How? Right? This is a critical question which is often not addressed, because our conventional methods in assessment, that these parts stand alone. There is no connection between the so-called chief complaint and the assessment. That if I say a patient is saying I have a problem in grasping an object, does the following assessment change according to that? Answer is no. We have a set format. So what happens is, these are all practiced as some kind of ritual without having a proper understanding of why it is done. Now if we write a problem such as difficulty in walking, what does it tell? In walking, let us say most of the patients with stroke have difficulty in walking, but they encounter different kinds of difficulty in walking. Some patients have extreme fear of fall. Some patients have difficulty in terms of they need 2% to hold. Some patient has difficulty because they need somebody's supervision all the time. Some patient has difficulty in walking outdoors. So all these different types of walking related problem have been clubbed into one category, difficulty in walking. So that is why I said this way of classifying patients as having difficulty is of less useful. It doesn't allow us to analyze the problem. Say if you say difficulty in walking, right, what is the patient is having problem in a particular surface characteristics, or are they really having problem especially when they have to turn, or when they have to cross an obstacle? Can understand. So this is a problem in simply writing it as a chief complaint. So what do we do? What is the solution? Is there a better method? I say yes, there is a better method in which we can write problem more specifically, that allow us to define a problem, and also this recording of the problem can be communicated to other therapists and other professionals using a common language that everybody can understand. If you say gripping or if you say walking, that a lot of people, different professionals, may understand things differently. Walking means what exactly is the problem. Gripping means what exactly in gripping is. Are they having problem in reaching toward object, or are they having problem in grasping, or they having a problem in lifting it, right? All are clubbed together as a gripping problem. So the solution, what I suggest, is to use ICF terminology, which the terms are clearly defined, and it is everybody, because it is given as a common language that all professionals can use. Now, if a lot of rehabilitation professionals, especially physiotherapists, are pretty much aware about ICF, but ICF is conventionally taught as a disability model. Now you have these impairments, you have activity limitation, participation restriction, and you have environmental factors, personal factors. So the ICF is people view primarily from the perspective of disability model. But it is true, it is one of the use of ICF is a disability model that allow us to understand what all the different factors contribute to the disability, that is especially activity and participation restriction problem. But the another use which is specified in ICF itself is that it provides us a taxonomy of the likely problem patient may have. And as I just want to emphasize, whenever we say or patient problem, it has to fall under activities and participation domain only, because from a patient perspective that is the real problem. Now, physiotherapists often have the tendency to write muscle weakness, spasticity, contracture as a problem, and they also set a goal to reduce it. But that is an inappropriate practice. That doesn't fit well within our current understanding, especially within the paradigm of patient-centered care. In patient-centered care, activity and participation should be considered as a problem. Impairments, personal factors, environmental factors are contributors to the problem. They are either sometimes independently contribute to the problem, or they mediate or moderate the effect of an impairment's influence on a particular problem. Say for example, for walking, muscle weakness can be one of the contributor, or the environment can be another contributor. Personal factors such as age and obesity and lack of motivation, fear of all can be a contributor. So these are all not the problem per se, this is the contributors. So now what I'm going to show now in this video is how you can use ICF as something as a tool for you to specifically identify a patient problem, and also giving ICF code to the problem identified. So from conventional chief complaint way of writing chief complaint to, I'm encouraging you to use ICF as a standard tool to identify patient problem, right? Right. So this is the ICF page that we have. Okay. You can come to this page by just typing ICF browser in your in a Google page. It will come to this place. Now what we are able to see here is how ICF is organized in different places. How the ICF is organized across various domains. Right now, I'm sure you are able to see this. Right? Just a moment. Yes. So you can see here how in body functions that it has been how it is organized. That is body functions, activity and participation, environmental factors, and body structures. Now specifically, while identifying problem, you needed to look at activities and participation. Now activities and participation is organized, it's subdivided into 9 categories, right? D1, D2, D3, D4, D5, D6, D7, D8 and D9. D specifies for activities and participation. Now within that you can look at the common problems in mobility, right? So you can see mobility, there are different problems in mobility, self-care and domestic life and so on. So let us say our patient is saying that having lift problem in lifting hand. So you can just type here lifting hand and find what is more relevant. So as you can see here, lifting and carrying objects and picking up, two different ICF codes are given that is specifically for lifting hand. So you can get here, open it, and then see it is clearly defined. Raising an object, taking something from place to another, such as when lifting a cup or carrying a box or a child from one room to another, right? So instead of writing lifting a hand, you can use this common terminology such as lifting and carrying objects, preferably with a code that is D430. Now when you write something like that, the advantage is that this term lifting and carrying object has been clearly defined, so anybody can check what actually it means, and this coding can also help in terms of documentation much better, right? So this would allow us to write down record patient problems more clearly from the patient's perspective, and it is more specific, it is clearly described so that it avoids ambiguity in communication, and also this is a common language that is across the world, people are familiar with it, or people can always come and look at it. So this helps us recording problem in a way that is understandable to everyone, right? So that's all I have. Just try it, just whatever patient says, just put it in here and where it fits, and then write that problem in a specific manner using ICF browser, right? If you're having any questions or need clarification, you're free to contact me.